This is session 6 of the conditions associated with the integumentary system, and here we are going to look at allergic conditions of the skin, and under this we look at allergic skin conditions such as dermatitis, where we have types: contact dermatitis and then irritant dermatitis. And we also have urticaria rashes or reactions, and then we also have angioedema. So this session or this slides, I'm not going to go through with you, but when you go through at the end, I expect that you should be able to identify patients, clients experiencing allergic reactions. Allergic reactions can come from even when we take certain drugs or even common food. We can have reactions, and then we have to explain the role of histamine employed during allergic reactions, and then describe the mode of allergic reaction, and then describe proper assessment and then treatment for patients and the clients experiencing allergic reaction. So in your reading, you may come across dermatitis, and then you can also you may also come across urticaria, hives, or angioedema. So I have provided the notes for allergic reactions, and the dermatitis, as I've told you, we have atopic dermatitis and then the contact dermatitis. And then the clients with contact dermatitis, I have the definition for dermatitis in general, and that is inflammation of the skin characterized by erythema, pain, and then itching. And then dermatitis may be chronic, and again we have several factors and two major types. We have atopic, which is another type, and then we have contact dermatitis. The atopic one is irritation in chronic dermatitis as caused by other factors, and then in most cases in the treatment we need to look at certain factors. Probably specific factors can be identified and then prevent those ones. So we have the nose, and then we have, as part of the assessment, we need to clearly do proper assessment with inspection and then palpation in order to identify the types and then address them accordingly. And so assessment is very important in this. And so the management of all the types, topical corticosteroids may be very, very important. And then in some cases we can also have oral corticosteroids, which may be prescribed for generalized manifestations. And then the patient education, which is very important as the cause and then prevention. And the antihistamine may also be identified. By antihistamine, we should be able to look at the side effects, and then nursing care should also point at anxiety and then body image disturbances, and then risk of infection, especially superimposition, and then due to skin impairment, we have to look at that, and then sleep pattern disturbances, we have to look at that, and then social isolation because of embarrassment about the appearance. I remember a child had this kind of condition sometime back in my ward, and then when the child was discharged to go home, the child said that he would not go home because of the embarrassment, stigma associated with it, and then all kind of social image disturbances. So we have to do proper education to both parents, the father and the mother, and then the child as well. So education is very important. Urticaria rashes can come from so many causes. We have the hives, and then that can come from so many causes: taking of food, administration of certain drugs, and the others. So we need to treat, look at it, and then you have also reading assignments. We have to read on the lupus erythematosus, and then papillosquamous diseases, psoriasis, and the rest. These are common diseases. Thank you very much.